Hello, my name is Jana. I'm currently a F&P student at Maryville University, and I have Cindy here who's going to be my patient when I do her assessment for her ears, her eyes, and her nose and her throat today. At first, we had Cindy do a Snellen chart to check her distant vision and a Rosenbaum exam for near vision, and she passed those fine. I look at her external eyes and make sure that they are in the correct position, that her nose is also midline, that her mouth is midline, and everything is on her face is proper distribution. I look at the hair growth on the eyebrows, nice and distributed, and her eyebrows come out to the temporal canthus, that her eyelashes fan out nicely as well. So after examining her hair on her eyes, we look for palpate for any orbital edema, and then we check. We then go on to check her eyelids. I will palpate her eyelids and make sure there's no nodules there. I'll have her open and close her eyelids, make sure there's no any kind of drooping when she opens and closes her eyes. I look for redness, swelling, flakiness, all of those things that could go wrong. I then look inside her. I take my pen light and I will examine the inside of her eye. I will look at her conjunctiva, make sure that it's pull down her eyelid carefully, make sure that it's nice and pink, and her lacrimal gland, that there's no discharge. I will look at the sclera as well at the same time, make sure that it's nice and white, that there's no abrasions or foreign bodies. We will then go on to check her corneal clarity, make sure her cornea is nice and the correct color and shape. I will check her pupils, make sure her pupils are equal, that they are round and reactive to light, and that they accommodate to light. So if I go with a pen light like this, her eyes will come together. I will then check her extraocular muscles, and we will do this by doing a corneal light reflex. So I check inside her cornea, make sure there's a red light reflex on each eye. If you look directly into my light here, great. And I will check for I'll do the cover. It's called a cover and uncover test, which basically Cindy will cover one of her eyes, and you will let me know. We check for any extraocular movements, and you will let me know how many fingers I'm holding up.
3.
Okay, and cover your other eye.
4.
Okay, great. So she did a good job there. The next thing I will do is check for the 6 cardinal fields of gaze, and by doing that, we will have the patient ask the patient to look directly at my pen light. Do not move her head, and follow the pen light as I go side, up, down, side, up, down. Good, and that they are accommodating as well. We will then take the ophthalmoscope and we will inspect the inside of the eye, which looks deeper into the eye. What you want to do is you want to position yourself. So I'm going to be looking at her left eye here. So that means I put my right hand on her forehead, and I will examine her eye closely this way and stand on this side of the patient and look with my left eye as well. And here we're checking for and to make sure that everything looks clear. The blood vessels look nice and intact, that there's no foreign bodies way back in the eye. I can see the optic disc, which is nice and round, and pupils look good, retina and everything looks appropriate. Okay. I will also, and I've already checked for the red light reflex. You could do that with the ophthalmoscope, or you can do that with your pen light. We will then go on to her ears and look at the external ears first. We will palpate her auricles, make sure there's no nodules, check behind, make sure there's no nodules or tenderness. Make sure the ears are symmetric and in good good shape, no flakiness. We will then inspect the inside of her ears, and you can use an otoscope, or if you're checking more external parts, you can also look with your pen light. However, here I'm checking to make sure there's no abnormal discharge and that the ears, there's no cerumen or extra wax buildup, we can call it that. Inside the ear, when I look, I can visualize the tympanic membrane, which is nice and pearly gray, and it's not perforated, no drainage. And let's say I can also see some nice bony promises. We will then, after checking the internal ear, we will do a hearing test. One of the tests is called the Weber test, where we use a tuning fork. And I will strike the fork, I will put it on Cindy's skull, and you let me know when you can no longer hear the vibration. Okay, and then the next test is called the Rhine test, which we do also use the tuning fork. We strike it, put it behind the mastoid process, tell me when you don't hear the sound. And then you put it in front of the patient's ear, tell me when you no longer hear the sound. Great. And also remember that air conduction is 2 times longer than bone conduction, so make sure you're watching the clock when you assess that. After assessing for hearing, you also want to do something called a whisper test, which you basically stand behind the patient and say a word like apple, and have the patient repeat the word to you. I will also check her frontal sinuses for any tenderness, and her maxillary sinuses for any tenderness. We will then, so we looked at the ears, we looked at the sinuses, we will then observe, we'll go, let's look at the nose next and make sure we check the bridge of the nose, make sure it's midline, the bridge it looks fine. I'm gonna look inside here and just make sure that the septum is not deviated, that the nasal mucosa is nice and pink and moist, and there's no extra drainage or any like nodules or anything inside the nose. I will also look at, next we will do the nasal patency, which you have the patient basically close one of the nostrils and inhale in, and the other one and inhale in. Great. We will then inspect the mouth and look at the external mouth. There is, look at the lips. Her lips are nice and pink. There's no cracks. There's no fissures. We will look inside the mouth now, and what we want to look at is the buccal mucosa, that it's nice and pink and moist. We'll look for lesions, lacerations. We'll look at the teeth and make sure the surface of the teeth is nice and pearly white, and there's no buildup, that there's no cavities or missing or loose chipped teeth. We look at the tongue, have the patient stick out their tongue, make sure that it's nice, good color. I have them turn it to the right and the left. You really want to inspect the sides of the tongue and underneath the tongue, because it's a common area for oral cancers. We want to look at the back of the throat, have the patient say ah. At this time, we're also looking at the uvula, make sure that it's in the center, and we will look at the posterior pharynx, which is that there's no any kind of pustules or anything like that. Look at the tonsils, and if the patient still has their tonsils, you want to make sure that you want to note the size of them, especially if they're complaining of a sore throat, and if you see any exudate. We will then check the patient's gag reflex. You can use a tongue depressor for that. Basically, you just have the patient open up their mouth and see if there's a nice gag reflex. And that will conclude our exam. Thank you.